Welcome. Thank you so much for joining us today. Happy to have a great conversation today with Lisa Hutcheson. She's the Vice President with Mental Health America of Indiana. She also has been the longtime program director of initiatives like the Indiana Coalition to Reduce Underage Drinking and the Indiana Collegiate Action Network, among others. And be it April and Alcohol Awareness Month, we wanted to have a great conversation about just the kind of current state of affairs of where we are related to alcohol and challenges that we have with it with underage young people on college campuses, et cetera. So Lisa, welcome. Thank you for joining us.
Thanks. Happy to be here.
Absolutely. So can you tell us just briefly a little bit for the audience who may not be as familiar with the Indiana Coalition to Reduce Underage Drinking or the Indiana Collegiate Action Network?
Sure. So the Indiana Coalition to Reduce Underage Drinking was formed in 1997. So I've been at this a few years. It's basically a statewide coalition focusing on making communities safer by reducing access to alcohol, whether that be through programs or policy or education. And then the Indiana Collegiate Action Network is a statewide network of college and university campuses of all kinds and sizes, I'm happy to say, that we are able to support through funding of mini grants so they can implement evidence-based programs on campus that address substance use and mental health. We have an annual conference. We do a biennial survey. We provide technical support and assistance. We develop great tools like Empowered Choices that are free for our campus members to use. And it's a great network that can share with each other about what works on their campus.
Excellent, excellent. Thanks for kind of recapping that for all of us. So as you know, as I mentioned, April is Alcohol Awareness Month, and that's always kind of a time to maybe take, at least for professionals, an opportunity to reflect a little bit. And so I wanted to just ask you what kind of trends you might be seeing around the state or even nationally around alcohol use, particularly among maybe college students.
Sure. I think the biggest one that we are finding is the THC infused alcohol. And as you know, marijuana is not legal in Indiana yet, I say. And so campuses are really struggling. Campus coalitions that include bars are really struggling on what to do with these products. There are very few guidelines for consumption on these products. In Indiana, these products are not regulated in any way. There was a bill in the last session to try to do that, but it did not pass. So I think campuses are struggling with what do we do with these beverages, because there's a lot of misinformation about THC infused alcohol and THC infused beverages in general that may not even contain alcohol. So if you have a student, for instance, who is in recovery or just choosing to not consume substances, they might consume these products not understanding what is in them. And also, of course, if it contains alcohol, those are both depressants, so they're working really in tandem and will multiply the effects of alcohol. So I think there needs to be a lot more research done on these beverages and a lot of input from campuses and from law enforcement and others on the impacts of these and how they should be consumed and, what guidelines people should be following, because even in states where marijuana is legal, there's not a lot of guidance on these beverages.
Yeah, absolutely. And I guess maybe this is somewhat related. I feel like we've seen numbers over the last year or two that shows that alcohol use is down generally, but we see clearly marijuana and other pieces rising. Can you talk a little bit maybe about whether that's a factor in some of this or to just generally the trends we're seeing?
Yeah, this current generation, and we have two young men who are in college, 21 and 24, they've really embraced the sober curious movement. this generation of college students are choosing to drink much less alcohol than previous generations before them. But as you mentioned, they are using more cannabis, even in states where it's not legal. And I think that's for a lot of reasons. A lot of them are, aware of the impacts of alcohol. Now we have research coming out every day on the connection to cancer and all kinds of other things. So they're very attuned to that and also how it impacts their mental health. And I will say for this generation, it's refreshing that they are able to talk about mental health issues and not feel as stigmatized as other generations before them have. And they recognize that, they may be on anxiety medications or other medications where alcohol is not advised. So they are drinking less, but they're using more cannabis, which is interesting because cannabis also can impact mental health medications and exacerbate mental health conditions.
Absolutely. So it's interesting. I mean, you bring up mental health. One of the things that we have, I imagine, several practitioners that'll listen to this conversation. And so just remind us, what are some of the signs? Because we see folks with mental health, you mentioned it's a depressant, right? We've heard that for years. But how does that interact with somebody suffering from mental health issues? And what are some of the signs that maybe we could see that somebody's exacerbating their issue?
Sure. Well, there is a tie between substance use and mental health disorders. Oftentimes, there are co-occurring disorders. So you may not know that you have a mental health disorder. Maybe you haven't been diagnosed with one, but you feel depression or you feel anxiety. So oftentimes you will self-medicate with substances, and one of those is alcohol. So it's kind of circular. You drink because you feel bad, and then you feel bad because you drink. And so there's definitely a connection there. So someone may consume alcohol at first at parties or with friends, but then they withdraw and start drinking on their own, maybe in their dorm room, in their apartment. They'll start consuming alcohol without the social aspect. Maybe they start missing class. Their academics start to fail because they aren't going to class, they aren't doing their assignments. Maybe they stop connecting with friends and family. You may not notice them at parties or in class, or they might not text anymore if you're good friends. So just that isolation and that not wanting to socialize is a big red flag.
Yeah, that's good things to kind of look for, particularly as a friend or let alone a professional, in truly trying to understand these changes that might be occurring. So thank you for kind of walking us through some of those very specific things that we could take a look at. Thinking a little bit more broadly around the community, and so a lot of the work that you do, that iCrud and ICANN are involved in, think about the community supports that are in place. So whether that be on a college campus, whether that be the community and all the social service and supports that exist. Can you talk a little bit about some specifics or things that you've seen communities do to help kind of reduce the stigma, but also get at trying to combat this issue?
Sure. I think we've are turning a corner on stigma. It's much more prevalent that people will talk about their experiences, including athletes and celebrities and people that young people look up to. And there are a lot of, Instagram accounts, and you can find them on Facebook and Twitter of people telling their story. So I think that's a big part of it, being willing to tell your own personal story about your struggles with mental health and substance use, particularly alcohol consumption. We had, the speaker at our last ICANN conference that told her story of the same exact thing. And, she has a wide following of young people. So I think that is an important tool to use your voice. I think communities can offer non-judgmental information. Like, here's just some information if you're curious about how alcohol might be impacting you or how other drug use might be impacting you. So just having that information and those resources available, I think that goes a long way reducing stigma. And then using non-stigmatizing language. And this is something that, I really have learned over the past few years of working with colleagues who are in recovery, putting the person first, not saying that someone is an addict, but they have a substance use disorder, an alcohol use disorder, not saying that someone is schizophrenic, but they have schizophrenia. So just even changing the way we talk about mental health and substance use to make it non-stigmatizing and really putting the person first goes a long way to help break down some of those barriers.
For sure, the language is important. Absolutely, the way we frame things. Those are good reminders and maybe tips for some folks. So last kind of question for this conversation, at least. And so I was thinking about, what can organizations and colleges and whatnot do around this month in particular, when there's maybe more eyeballs and focus and attention around it. What are a couple of the more unique or effective things that you've seen over the last several years that you might want to share as something that another group could consider doing?
Sure. I think our campuses do a great job of implementing alcohol-free programming that's still fun and interesting and is going to want to make students attend. I know that several law campuses, for instance, do like tabletop events where they will have red Solo cups and colored water and say, okay, I want you to pour what you think is a standard drink. And it's surprising how many students think they know what a standard drink is when really they don't. And when they realize that Solo cups are made that way for a reason, because it kind of guides you to what a standard drink is, it's a great opportunity for education, but it's also kind of a fun and eye-opening event. And I know a lot of our campuses have done that. There are some more evidence-based programs that you can do, but a lot of people like to use the drunk goggles that maybe your local police department has with the tricycles. I know that's something that particularly college students like to do, and some post-prom groups have done that as well in conjunction with education about alcohol.
Sure.
So I think the key is to make it interesting and fun while making sure you get that education out there. I know some of our campuses have done silent discos, which students find really fun. I actually would love to go to one of those someday. And a lot of wellness focused things, like some of our campuses have done outdoor yoga classes that are tied to, substance use prevention and mental health promotion, and students seem to like that. I know in one of our campuses up north, they did an ice skating party. So I think the key is to make things fun and interesting for students. Are we going to stop all underage drinking? No. But if you can at least have them at your event for a couple of hours, it might help them think about, well, maybe I shouldn't consume that much alcohol when I go on to this party or whatever. And there are always opportunities to educate without feeling students and young people feeling like you're preaching at them. So, make your information relevant and fun. And, nothing against us, but if you and I talk about these things and, we are not the demographic, we are not a peer. So peer education and peer involvement is really important in high school and in college, actually. A peer will listen to a peer before they will listen to someone with gray hair or wrinkles like me. So.
It's a very important point, and a strong one to have kind of bookend that part of the conversation. So I'm going to take the liberty and do a PS, because I said that was the last question. So I'm going to then just ask in question briefly about, we're in between. One of the other roles that Lisa does is she advocates policy changes at the State House here in Indiana. And so we're in kind of this lull, right? We're done with session. We're going to be gearing up for a budget year, right? Coming up this next year. How can, or what should folks out throughout the state be doing now, interacting with you, interacting with other supporters, so that come the session, we're ready to be mobilized and go?
Sure. The long session, the budget session, as you mentioned, gives more opportunity for more bills to be introduced. We know that there will be additional marijuana bills introduced to legalize. There will be iGaming bills introduced next session. So a lot of issues that are really important to the wellness of our young people. We know that young men on college campuses gamble at 6 times the rate that general adult population does. So, gambling has become a big issue. In fact, we just created a module for our Empowered Choices online learning platform that covers gambling, because we know sports betting, having just hosted the Final Four, we know how much that happens on our campuses. So now is the time to meet your legislators while they're at home. If you wait until session to talk to them about issues that are important to you, it's going to be too late, because they're very busy during session. So meet them now. If you don't know who they are, you can find that by Googling Indiana General Assembly, and it will link you to a place where you can put in your address and find out who your legislators are. Meet with them now. Share your concerns with them. This is how, alcohol, gambling, marijuana impacts our campus or our community. We'd like to share those concerns with you. That's really important. Also, you're the expert in your field. They aren't. They have thousands, literally thousands of bills to read during session. They can't know about everything. So it's up to us to educate them about, issues that are important to us or impact the communities we work with, like college students, adolescents, teenagers. So you are the expert. Use your knowledge, educate them, and keep in touch with them. Build that relationship. That's really important.
Excellent. Appreciate the time, Lisa, as always. Thanks so much. And again, if you have any questions, you're able to reach out to either of us at any time. At our websites and our social media. So we look forward to hearing from you. Until then, till next time, thanks so much.
Thanks. Bye.